Well, good afternoon, and thank everyone for joining us today. Today I'm joined by Dr. David Folsom, who's the Director of Clinical Psychiatry and Vice Chair of Clinical Affairs Department of Psychiatry at UCSD Health. I'm also joined by Catherine Nicario, who's CEO of NAMI San Diego, as well as Baron Herdland Doherty, who's the President and CEO of the San Diego County YMCA. You'll notice something a little bit different today. We all have on facial coverings, and we will be going forward as all of these updates to continue to have them to help get the word out to stop the spread of COVID-19. As you know, yesterday the state and the county issued guidance that recommends all San Diegans wear facial coverings while outside the house. And about 2 hours ago, the CDC made the same recommendation for the entire country. These are coverings, not masks. We want to leave the masks for the nurses and the doctors so they can stay healthy, so they can help us. As our medical professionals have told us, if you leave your place, cover your face. And please remember, the directions on face coverings are in addition to the guidance to stop the spread of the virus. Washing your hands very often for 20 seconds with soap and warm water. Do not touch your face. And if you can, please stay home. Today I'm going to cover a few important topics. First, ways San Diegans can keep healthy while they're staying at home, both mentally and physically. Second, a few updates on facial coverings. Third, an update on our public safety personnel. And lastly, our daily shout out to San Diegans who continue to step up during a time of great need. This crisis has impacted every aspect of our lives. Servers and housekeepers who were benefiting from a strong economy just a month ago are now navigating unemployment resources. Parents are balancing childcare while working remotely. And hospital staff and our first responders are taking care of our community while also trying not to bring the virus into their own family. We're all intently focused on our jobs, our schools, our children, our parents, our grandparents. So today and over the weekend, we're asking folks to remember to take that deep breath. I want you to remember, don't lose focus on making sure that you're taking care of yourself. And I know that we're all taking care of one another. Not only should you be focused on your physical health, but we should also be focused on our mental health. That's what we're going to talk about here a little bit today. It can be easy to quickly lose the daily routines that once really defined our lives. The daily gym visit, the lunch with friends, the weekend outings. These are necessary sacrifices, however, to slow the spread of this virus. San Diegans are adaptable, we are creative, and we can find ways to take care of ourselves while staying home and staying safe. For example, I've tried to keep up and doing my daily walks around my neighborhood. It's almost always interrupted by a phone call, but it's always good to get out of the fresh air. So today I am joined by health experts who have been assisting San Diegans to find their own ways to keep mentally and physically active. Each of them are going to offer some resources that San Diegans can use. So in a few moments, Dr. Folsom with UCSD's Health Psychiatry Department will say a few words about how we can practice better health. Catherine Nicario with the National Alliance on Mental Illness will share resources for individuals, families, and children. And Baron Herdland Doherty with the YMCA will talk about the programs they are now offering online, available to all San Diegans. But first, a little more update about facial coverings. Early this week, as you know, I issued an executive order designated all city employees as emergency service workers. It's one of the proactive steps that we're taking to help our entire community. In the meantime, there are many other city employees, like our police officers and our firefighters, who continue to work with the public on a daily basis. We want to keep the public safe, and we want to keep our city employees safe. So on Monday, the city of San Diego is set to receive a shipment of 10,000 facial coverings, and these non-medical grade washable and reusable cloth masks. Again, we don't want people using medical-grade N95 masks unless they're providing critical health and safety services. Let's save those N95 masks for our nurses and our doctors. And these facial coverings will be distributed to all city employees next week, first to our essential service employees, then more widely to other departments as appropriate. So I'd like to thank particularly our purchasing and contracting team that really worked very, very quickly, particularly Christina Peralta, to secure these masks for our very valuable city employees. Before I continue with our public safety update, I also actually want to share some news we just got a couple of minutes ago regarding operations at the border. Starting Sunday, all pedestrian processing, both northbound and southbound, will take place now at the PED East facility. Processing at the PED West facility will be suspended. Next, as I do regularly, I'd like to provide the latest update from our public safety professionals. At this time, we have no new public safety personnel that have tested positive for COVID-19. In addition to that good news, we have some more. This morning, I spoke to our lifeguard division chief, Chief Gartland, and he informed me that one of our lifeguards that had previously been tested positive for COVID-19 has been medically cleared to go back to work. The lifeguard is excited, is feeling good, and is ready to get back on duty. As I mentioned before, April is the critical month to stop this virus from spreading. That includes on the weekends. Directives against gatherings are in place to protect you and your family. I know it isn't easy, but if we work together and we stay home, we will be able to flatten this curve and save lives. Now I'd like to introduce Dr. David Folsom with UCSD Health to say a few words. Doctor?
Thank you very much, Mayor Faulconer. I appreciate the opportunity to come here and speak a little bit about the importance of mental health during this COVID pandemic. As we adjust to the personal, the professional, the lifestyle changes that we're all having to make with COVID, it's understandable that we're going to have different mental health concerns. Anxiety, stress, depression are just going to be more common. For people who are already dealing with mental health problems, this is a time when their anxiety and their depression may be worse. It's important to know that mental health services are still available. Many of these services are now available by telemental health or telepsychiatry, so you don't have to go in person, and you can still see your psychiatrist or your therapist and get the care that you need. At UC San Diego, we've really greatly expanded our capacity to provide telemental health services. Right now, about 80% of the patient visits we're doing are by video telemental health services, and 4 weeks ago, it was pretty much zero. So we've made a huge expansion in that area, and everyone else in the county has too. It's been very impressive. So, now's the time to get in touch with your mental health provider. Make sure you have an adequate supply of the medications that you need, and know that treatment is still available. For people who weren't dealing with a mental health problem before COVID, this is still a really anxious and stressful time. And it's important to do things to manage your anxiety and maintain your good mental health. First, and I think most importantly, recognize that everyone around you is also really anxious and stressed. Take some extra time, take a couple extra steps to be more patient, more considerate, and more understanding of others, and probably do the same for yourself. Some of the key things that can really help manage your anxiety: talking with your family, talking with your friends. We've been using FaceTime and Zoom at our house to keep in touch with our family. We're scheduled a online Zoom poker game tonight to keep in touch with friends. I think that's really important right now. Get out and get some exercise every day. Of course, you'll have to follow the guidelines and make sure you keep, separate from other people, but you can still get out, get some exercise, and take care of your physical health. That has tremendous mental health benefits. Practice things like yoga, meditation, mindfulness. I think it's also important to take a break from technology. It's surrounding us right now. We're on our phones, on our computers, on our iPads, watching Netflix, updating on the news. Instead, take some time to engage in hobbies, maybe reading a book, maybe doing a puzzle. It's also important to limit the things that make your anxiety and stress worse. Limiting how much you drink. Now's the time that people could easily drink too much. Same with drugs, avoiding drug use, avoiding unnecessary prescription drug use. And for many people, I think limiting news consumption and social media is also really important to maintain your mental health. There's ways that you can stay informed and stay in touch with other people without feeling overwhelmed and increasing your anxiety. So please, now's the time to make good use of all these things, because maintaining your good mental health is key to maintaining your overall health. Thank you.
Thank you, Don. Thank you for that. I think of those great words. Next, I'd like to invite Catherine Nicario, who's CEO of NAMI San Diego, to say a few words. Catherine?
Thank you so much for having me here today. During this time, it's very important to protect our mental health. Tending to our mental health is just as vitally important as our physical health. During this new normal for all of us, there are strategies that we can implement in maintaining a lower level of anxiety and stress in order to maintain our mental health. Number one is, if you're telecommuting and teleworking, keep a strong routine in your home. Help to keep boundaries between your work life and your home life. Designate a specific workspace. Keep normal work hours as much as possible, and get dressed for work. It may not be in a suit and tie every day, but you can dress in business casual or some nice sweats, and it really may change your mindset. It's important to stick to your regular bedtime and waking schedule as well. Just as important are consistent meal times, maintaining a mental and physical balance with healthy foods. And to echo what Dr. Folsom said, if you are on a mental health treatment plan, continue with appointments through telehealth methods such as videos or phone calls. And also have an adequate supply of medication. Most insurance companies are now allowing for a 90-day supply. Also, take reasonable precautions and look at where you're getting your information from, and make sure it's from reliable sources such as the CDC or our own San Diego County website. And also, get moving. It's vitally important to protect your own health. Practicing mental hygiene boosts your psychological immunity. This includes exercise as a stress reliever. Go for a long walk, maintaining your physical distancing. We'd like that term a little better than social distancing. Do yoga. There's a great amount of at-home apps, online apps that you can use to keep the body moving. And also using guided meditation. It's a great way to calm the mind. Apps such as Headspace, Calm, and 10% Happier are just a few examples. Now let's switch gears a second on how to help the mental well-being of our children and our family members who may be experiencing a high level of anxiety and fear during this time. Kids' whole worlds have changed. With schools being closed, no group activities, no social contact, they may be feeling very worried and scared. But as mentioned before, we must first take care of our own mental wellness to help others with theirs. So a couple of tips for the kids in your household. Kids watch our every move, are very in tuned into our feelings and behaviors. So make sure that your self-care is there. And a few other steps to consider. Get the facts and share. If your child is fearful of illness, tell them we're staying home so we can be healthy. Establish a routine. Establish a modified school schedule with different activities about every 30 to 40 minutes that kind of mimics the school day. And have a scheduled lunchtime together. Making sure that they're getting enough sleep, eating healthy foods, and getting their own physical activity as well. Staying connected with family and friends through FaceTime, Zoom, Skype, and setting up virtual play dates can also be very helpful. And then always focus on the positive. There are several resources available here in San Diego. NAMI San Diego, we in particular are moving our support groups, classes, and parenting sessions to an online platform starting tomorrow. You can join us on Wednesdays for Mental Wellness Wednesdays, where we have a topic and an Ask the Doctor time for questions to be answered by a psychiatrist from UCSD's Community Psychiatry Department, led by Dr. Stephen Coe and his staff. Please check our website, www.namisandiego.org, for updates starting on Monday, April 6th, for being able to join support groups and classes. Also, our NAMI San Diego helpline is coming back up online with trained peer and family support specialists by the end of next week. That phone number is 1-800-523-5933. Also, the Access and Crisis Line is for all types of resource needs, from food to housing to speaking with a mental health clinician. They can be reached at 888-724-7240 and also 211. Most of all, be kind to yourself and others, and be safe, both mentally and physically healthy. Thank you.
Evan, thank you very much. Last, I'd like to invite Baron Hurdle and Doherty to say a few words. Baron is with the YMCA San Diego County.
I'd like to thank Mayor Faulconer and his office for inviting us to speak today. The YMCA of San Diego County has been serving our community for 138 years, and we've seen our share of challenges over the last century. But this pandemic crisis has changed and challenged and impacted us in new ways we could have never imagined. Now more than ever, we've fully committed to ensuring a strong and vital future for our YMCAs and all of the communities we serve here in our area through three focus areas: youth development, healthy living, and social responsibility. These are our guiding lights as we try to help serve all people here in San Diego. I'm proud to share with you that our YMCA has quickly responded to COVID-19 and the pandemic as only the YMCA can. As a nonprofit, we're much more than a gym or a place to swim. We're a safe place to nurture and uplift all people to help them reach their fullest potential. While you can't come into our facilities right now, we're able to help you connect virtually. You can find our virtual YMCA at ymcasd.org. In one website, you can access workout classes and activities you've known at your local YMCA, and maybe even explore new services that you will need during this time, like mental health and child care. Our YMCA Child Care Resource Service team is providing enhanced child care referrals to all local families that are needing or seeking care. Our YMCA team can connect you to available licensed child care provider in the county. All you have to do is call 1-800-481-2151. We're also working with government and healthcare leaders to help ensure child care access is available, especially for our essential healthcare workers and our first responders. During these times, we might take the time to maintain our physical health, but we also need to focus on our mental health, as you've heard already today. Our Youth and Family Services team has pivoted quickly to address mental health and the essential needs for our homeless youth and families around our area. Maybe you're finding this crisis that we're in, is tough for you as a single parent or an adult or a couple or even a group of two parents. Maybe your teenager has been looking extra sad or scared. Or maybe your 4-year-old is behaving different than you've ever seen before, and you're not sure how to deal with that. The YMCA is here with you and for you to make sure that your mental health is there for you and your family. And our professionals are ready to provide help, and affordable help, for everyone in our community. We have experts for all ages ready and waiting to log in and work with you and your family through these virtual appointments that you can set. For more information, please visit ymcasd.org or find us on our social media channel, YMCA San Diego. We're going to continue to add more activities for our kids, families, and active adults throughout San Diego. All you have to do is find us online. Our doors will reopen as soon as possible, and we will be ready to serve all San Diego so our community can thrive once again. Don't forget to use your virtual YMCA contact. Until then, take care of yourself and your families. Together, one Y. Thank you.
Thank you. Thank you, Baron. Before I recognize San Diegans who step up during this time of great need, I want to acknowledge somebody who's been very special to a lot of folks, and that is Chula Vista City Council member Steve Padilla. He was, as you think you know, one of the first, not the first elected official in California to test positive for COVID-19, and he has been incredibly brave battling the virus. Today, Steve announced that he has left the ICU. So Steve, I'm glad you're feeling better, my friend, and I can't wait to see you back in action. I will conclude with San Diego Steps Up story for the day. As I said earlier, these times really brought with them increased stress and anxiety for everybody. It's part of what today was all about. And as the mental health leaders behind me have emphasized, now is a time to take care of yourself and to be kind to one another. So I'd like to end these briefings, as you know, a little bit of kindness and inspiring stories of San Diegans who are stepping up to help out their community. Today, it's a whole organization, the San Diego Gulls. And following the directives limiting gatherings across the nation, many of our favorite sports, of course, have been canceled or postponed. Well, the owners, Henry and Susan Samueli, knew this would hurt a number of organizations that are part of the Gulls family, including some of the restaurants that serve food during events at Pechanga Arena. So they stepped up to help out. And through the San Diego Gulls Foundation and direct donation from Gulls players, meals from 5 local restaurants that are partners of the team were delivered to our hospitals. Surfside Deli, Dino Euro's Greek Cafe, Cali Comfort Barbecue, Chipotle, and Rockin' Baja Lobster. They delivered more than 775 individual meals to the staff at 5 local hospitals. Our meals, all the meals were packaged individually with utensils to make sure our healthcare providers could enjoy them safely. So what an incredible example of San Diego organizations, both big and small, stepping up to lend a helping hand when it's needed most. So thank you to Henry and Susan Samueli, as well as the Gulls President of Operations, Matt Savant, for supporting our local businesses and helping our healthcare providers. Keeping those doctors and nurses and staff in your thoughts as we support them as they save lives. We have really seen the best of San Diegans in these difficult times. It's truly motivating to see everybody coming together. Friends, family, neighbors, and strangers stepping up to help one another. So if you see a San Diegan stepping up to help out their community, share it with the hashtag San Diego Steps Up. I thank everybody for their continued efforts, vigilance, and perseverance during these times. We all have a role to play. We will get on the other side of this, and we will be able to do that and look back to say we got through it as one city. With that, I will pause for any questions for members of the media.
Guillermo Mendez with Univision. Thank you again for having these daily updates. So now the weekend's coming up, and obviously we have new regulations as far as facial coverings. Is the city of San Diego prepared to do stricter enforcement?
Oh, we are, and obviously those county guidelines that were mandatory for some of those key business and industries, yes, but I'm actually very confident that's restaurants or others are going to step up immediately and do the right thing.
What are the instructions to the police department? I mean, are you guys ready to start issuing citations? I know we heard yesterday the sheriff saying that they're going to start issuing citations to people that.
Yeah, no, I will tell you, our San Diego Police Department, Sheriff's Department continue to work obviously hand in hand. Our officers have been out, our department's been out, particularly on business compliance, taking a very determined posture, not only education but enforcement. It is working. I expect that to continue.
Right. Thank you. Thank you.
Any other questions for today's briefing?
Mr. Mayor, we have 2 questions. One from Abby Alford, CBS 8. Going into the 3rd full week, much of the novelty is wearing off, and we are feeling the coronavirus fatigue. There are so many closets to clean, so many Netflix shows to watch, beach closures.
Yeah.
This has become the norm, and the reality has set in. What can we do to get recharged and not feel depressed going into the weekend?
That is a great question. And hopefully you had an opportunity to hear from some of our mental health professionals. It's one of the reasons why I wanted them to come and share some of the ideas, some of the tips, and the resources that are online, because it's incredibly important. This hasn't been easy. It hasn't been easy for anybody in any family who is all going through this. And so it is important, and why we have these briefings is to remind everybody that your vigilance is what will pay off. Your vigilance is what is going to save lives in San Diego. So proud of this region and the steps that we took, the early steps that we took, I think are going to make that difference to help keep that surge low. And so it is a reminder, it's a refresher, and it's an opportunity to see about resources that are out there, mental health, physical health, and to encourage folks to hang in there, because that's what will get us on the other side of that curve sooner rather than later.
Sir, one more question from Ellie Ross from Fox News. How is the system equipped to handle what will inevitably be an influx of new patients who may have had unrecognized conditions before COVID?
Yeah, and again, I can't say enough about the planning and preparation, the communication and the collaboration from all of our healthcare providers, and particularly our hospital systems, every single day, planning for surge, planning for opportunities. We've had a head start as compared to other regions across the country. I think that head start will pay off. But we also know that this planning and preparation and all the steps that we have been taking are going to be incredibly useful when we continue to see these cases rise, and we will. That's why the hospitals working together, not only on supplies, personnel, equipment, is what is really going to make the difference in the weeks ahead.
Hi there, Mayor. Kasha from Fox 5. This is kind of a topic we haven't touched on yet, but I'm curious to get your opinion. I know that this authority would definitely come from the U.S. Department of Transportation as far as shutting down domestic travel, and that hasn't come down yet. But what is just your opinion on domestic travel during this time, especially to and from kind of these hot spots where we're seeing more cases of the virus?
No, and appreciate the question, Kasha. And again, I think the importance, particularly of essential travel, is an important one. We deal it with here locally, on the local level, with essential businesses, which is why we are so determined to enforce that. If you're out, it should be for essential businesses only. By and large, that is working very, very well. We will continue to educate and enforce when necessary. And again, that is what is going to make the difference, not just here in San Diego, but for other cities across the country. And so I think it's important for us to continue to do that, to set that tone, to set that example, to enforce that, and we will continue to do that on the local level.
Would you potentially be in favor of a domestic travel shutdown, even if it were temporary or a couple weeks?
Well, I know that those are some of the things that they're talking about on the national level. Again, as mayor, what I'm concerned about is really enforcing our local ordinances, those that I think are serving San Diegans very well. That will continue to be my focus. I think it's having the effect that we want. We will see in the coming weeks, and that's why it's so important for all San Diegans to not go outside of your house if you don't have to. It's about staying safe. It's about making sure only essential businesses are out. And as we talked about today, it's about taking care of yourself mentally and physically.
Absolutely. Abby's question kind of touched on this, but perhaps one last time, I don't think anyone can hear it enough. Maybe your final message to San Diegans heading into the weekend, because we really need to hit home.
Yeah, it will be. It's a great question. Thank you. Final message is keep it up, San Diego. Keep doing what you're doing. We're seeing it work, even though it's difficult. But the actions that families are taking, the reminders of your friends and neighbors, that's what helps us get over this curve. That's what helps us prevent the rush on our medical systems, our ICU beds, our emergency departments. San Diegans are doing a phenomenal job so far. And as we said earlier in the week, now is not the time to get complacent. And I get it. It's going to be a nice weekend outside. It's been tough. But what San Diego's doing continues to shine. And we're seeing that across the country. People pointing to California, people pointing to San Diego as doing the right thing. I'm going to ensure that we keep it up. And so I'm very grateful for everybody in San Diego who's taking this as seriously as it is. We need that. We need to help do that throughout the entire weekend, and let's all remember that. So thank you. I think that was our last question. With that, that will conclude today's briefing. Thank you very much.